So, good afternoon. My name is Tim Kelly. I'm the respiratory therapist for Healthcare DME here in Ann Arbor, Michigan. And today we're going to be going over the basics of sleep apnea and the sleep apnea machine that we are currently using. It is the Luna G3 auto set machine. And but first of all, I just wanted to do a brief overview of what actually sleep apnea is. It occurs when you are sleeping. The soft tissues in the throat just have a tendency to collapse and create that obstructive sleep apnea. So, and what CPAP does is CPAP creates a positive pressure, continuous positive airway pressure that holds the throat open to allow you to otherwise breathe normally. Okay, so these machines are not necessarily breathing machines. They are not ventilators or anything like that. They're just simply designed to allow you to breathe on your own. Now, different people can require different pressures. Most of the people that we take care of have had a sleep study. One was done either in the home or was actually done in the lab. It is what is called a diagnostic study. It just determines that you have sleep apnea. Some people from there go on and get a titration study where they find out what pressure you're going. They actually hook you up to a machine when you're sleeping in the sleep lab and determine what the best pressure to treat your sleep apnea is and what mask will work best for you. Generally speaking, though, is what they do is they order a self-adjusting machine. So, also known as an auto set or an APAP. So what that does is that it starts off, you attach yourself, put on your mask, attach the hose to the machine, turn the machine on, and it starts off at a very low pressure. And that pressure, will stay there until you fall asleep. And once you fall asleep and you start having your sleep apnea, the machine will sense that and will start to kick that pressure up. It will kick that pressure up until your throat opens up and you start breathing normally. And then from there, it senses that and it will start to back the pressure back down until you start to close up again. And so it will continually do that throughout the night. It does get to a spot where it kind of evens out, and that is your therapy pressure, your therapeutic pressure. Where that pressure will be is often remains to be determined. That is just something that you just go home and use the machine, and wherever it winds up is where it winds up. So this here is the Luna G3 Auto CPAP. It comes with a built-in humidifier. This is the water chamber, and to remove the water chamber, you just simply press down on it and release it like that. There's a catch right here that catches right in the base there. So you're going to want to get some distilled water. You open it like that. You pour the water in through here. There's a maximum fill-in. Now, I recommend daily changing the water. Don't just add water, but change the water. Personally, I think you should empty the water out in the morning and allow it to air dry during the day, and then add your fresh water in the evening. So you may not necessarily need to fill it all the way up to the full line every time. So, and then wash this at least weekly. Soap and water in the sink is all you need. This is the heater plate. This is what warms the water. The warmer the water, the more humidity the air passing over it will pick up. You have here your memory card. So this is something that actually you'll probably never need. And the reason why is because this machine comes with a built-in cellular modem. So what it does on a daily basis, it uploads the information from the machine to a website. And we can access the website, and the sleep labs can access the website. So what it's going to do, it's going to show us things like how much you're using this. It's going to show us things, when I talked earlier about how these machines will self-adjust their pressure, it's going to show us what pressure it is adjusting to. It's going to let us know how well it's actually treating your sleep apnea, how well your mask is fitting, just overall how well you're doing on it. So it gives the doctor the opportunity to see if any changes are warranted. So that modem actually serves two purposes. One is clinical, and the other is financial. And that's because of your insurance company. Most insurance companies do not just purchase these outright. They do what is called a cap rental, or essentially a rent to own. They're going to make, most insurance companies make either a 12 or 13 month rental period. They make 12 or 13 monthly rental payments, and then it will be considered purchased. But they start off by paying for it for only the first 3 months. During those 3 months, you need to use this to a certain minimal extent, or they're going to stop paying for it. Insurance companies don't like paying for something that's just sitting in a closet, not being used, and gathering dust. So specifically what the insurance companies require, and there are some minor variations between insurance companies, but generally speaking, what the insurance companies require starting today, you now have a 90-day window, right? Just like that, just like 90 days. So sometime within the first 90 days of use, you need to have a 30-day stretch. It doesn't matter when in that 90 days that 30-day stretch is. It just has to be a 30 continuous day stretch where you use it at least 4 hours a night for at least 21 out of the 30 nights. So what that means, the 4 hours itself does not need to be continuous. If you wake up in the middle of the night and take the mask off for a while and later on put it back on, that's fine, just so long as it totals a minimum of 4 hours of use. And that is for that entire 24-hour period, which technically goes from noon until noon. 3 hours and 59 minutes doesn't count. But that is also 4 hours of use, not necessarily 4 hours of sleep. So if you're lying there in bed, tossing and turning, and you can't fall asleep, as long as it is on and running, it counts. Okay? So, and you need to do that for 21 out of 30 nights. The 21 nights do not need to be consecutive. They just need to be within a 30 consecutive day period. So you're allowed to take nights off entirely. For whatever reason, it doesn't matter. Say if you go out of town for the weekend and you just don't feel like taking this with you, that's perfectly fine. You don't necessarily need to start that count all over again. So, and you also have to have a follow-up appointment with the doctor. That appointment needs to be before the 90 days is up, and but it does need to be at least 31 days from your start date. So in your delivery packet, on the back of your delivery packet is your prescription. You'll need to give that office a call and schedule your follow-up appointment with that doctor. I recommend doing that the day of setup. If it's not feasible, then the next day if at all possible, because that appointment, you call these, you schedule this appointment, they generally schedule it at about the 2-month mark. So if you wait, forget about scheduling that appointment and then wait 2 months and say, oh, I need to schedule this appointment and try scheduling it, then it's probably going to be another 2 months in the future, and so you won't meet your compliance requirements. So please call the doctor at your first opportunity and schedule that follow-up appointment. So if you meet that criteria, what they call compliance, then the insurance will continue paying for the device for the remainder of the rental period, and then it will be considered purchased. It'll be yours. And they will also continue paying for the various accessory items, the mask, tubing, filters, chambers, stuff like that, according to a set schedule, and we'll go over more about that at the actual time of setup. Otherwise, they stop paying for it after that 3rd month, and at that point, either you become responsible for payment or you need to return the machine. Okay? So, that's the compliance requirements. Now, as far as the machine is concerned, on the back here is your filter. Okay? You actually have 2 filters here. You have 2 filters. You have a gross filter and you have a fine filter. Fine filter is actually considered a disposable filter. It's designed to be replaced every 2 weeks. The gross filter is designed to be replaced only every 6 months or so. So this filter sits in here like so. And then this one just sets in there just barely. There's a couple tabs there that hold it in place, and I mean just barely. So the air does go through this filter first, and then through this filter. So this filter will get dirty. So when you change this filter, rinse this filter out. And then just make sure it's dry before you reuse it. And it just sets in there like so. All right. So we have your power supply right here. It plugs into the back of the machine right here. Okay. And then we have the tubing. There are two types of tubing. There is a standard tubing, and then there is the heated tubing, the heated wire tubing. The heated wire tubing, the coil around it is actually a heating element, or more precisely, warming element, because it doesn't get hot. It only gets up to about 85 degrees. So when you feel it, when it's in use, it will be slightly warm to the touch, but it's not even body temperature, so it won't be hot. All it is designed to do is to help prevent condensation from forming in the tubing. Some people, and it depends on your insurance and how the prescription is written, that some people only receive the standard tubing, in which case it just won't have this electrical connection is all. So, but other than that, and it's gray, it's not this color. So this just plugs into the back of the machine right here. Okay, and then the electrical connection plugs in here. There's a spot. You'll notice on the connector, there's one corner that's a little bit, that has a notch taken out of it, and that just plugs into the lower right-hand corner. That's how that plugs in there. It'll only go in that way. So, this is your home screen. So this does have a screensaver, a power saver, so this screen will go dark after a couple minutes of inactivity. But if it's plugged in, it's powered, it's ready to be used. You have various tabs in here that you can access. The first tab is your preheat. That allows you to preheat the water in the chamber if you want to. It's a nice feature, but it's something you probably won't need to worry about until January or something like that. The next tab is your accessories tab. This is a tab that I'm not too impressed with. It is supposed to allow you to keep track of how often you need to change things. The problem is, it's at number one, you have to stay on top of this, and if you don't reset it when you change something, then obviously it's just going to get you screwed up. But also, like for example, it shows the air filter. Well, there's two filters in here. So which one are you talking about? One's every 2 weeks, the other's every 6 months. The tubing, gets replaced every 3 months. And then the mask, well, it depends, there are different components of the mask get replaced according to different schedules. So you're going to learn that certain items are distributed according to certain set schedules. Some items are allowed every 2 weeks. Some items are every month. Some items are every 3 months, and some items are every 6 months. We work in 3-month increments. When we ship supplies, we ship a 3-month allotment. So the items that you get 2 a month, you'll receive 6 of them. The items that are allowed only monthly, you receive 3 of them. The ones that are allowed every 3 months, you'll receive in your shipment, and that's when you change them. And the items every 6 months, you'll receive, every other shipment, and that's when you change those. So there are 2 basic styles of mask, and which type of them, there's a nasal mask or nasal pill mask, which generally either cover your nose or cradle your nose. They tend to be lighter in weight, less confining. There's not as much stuff on your head, but they do require that you breathe in and out through your nose. If you're any kind of a mouth breather, the air will go in your nose, and as soon as you open your mouth, it's going to come right out through your mouth. And then and that can be, very irritating. It tends to wake you up, and you just tend to rip the stupid thing off and forget about it for the rest of the night. And then there's the full face mask. Full face mask Either cover your nose and your mouth, or they cradle your nose and your mouth. And we have them on display. I'll show I can talk about them during the actual setup. But those full face masks allow you to breathe in and out through either your nose or your mouth. So one of the problems with doing a setup based on just like a home sleep test or the one diagnostic test is we don't know what pressure you need to treat your sleep apnea, and we don't know what mask will work best for you. So at for any given setup, the mask that we sit down and try is basically a guess. We won't know. I could try you on any mask in the entire house, and we won't know what mask is necessarily going to work for you until you take it home and try it. I'm pretty good at doing the initial setups, but any given mask, the patient will know within a couple hours, within a couple weeks, of whether or not that mask is going to work for them. And we'll discuss that more at the time of setup. But generally speaking, I like to try and set up our patients on a full face mask, at least to start with. And so I calibrate the machine right here for a full face mask. And I'll show you why in a little bit. This is your report. This is one way of getting the information from the machine. You just highlight that and select it. Select. And then this is your usage summary. You can look at last night, last week, last month, all the way up to last year. Your last night report already will come up in a different spot on the machine when you turn it off. It's your summary for that last night. And so this is kind of a duplicate. So, but it does show you here the things. It shows you like your usage statistics, your days over 4 hours. It shows you what is called a P95. So that is when the machine adjusts throughout the night. It does tend to get to a spot for each individual patient where it levels out at. Again, where that spot will be remains to be determined, but that, for all intents and purposes, is that number right there. Also shows your AHI, that's your apnea hypopnea index. That is how much sleep apnea you're still having, even though you're on therapy, because this may not completely eliminate your therapy or your sleep apnea, or your sleep apnea may worsen over time. So this is another one of the things that we look at on the download. Ideally, this number here should be 5 or below, ideally. And then it also shows you your leak, and this is something we'll work with when I do the actual setup. But whatever mask you have, and I calibrate the machine, any given mask has a leak built into it. And so when I calibrate the machine for that mask, it zeroes that out. What the machine does, it said it calculates for whatever mask you have, for whatever pressure you're at, you should be going through a certain amount of air. Anything above and beyond that then will be considered a leak. And even so, as long as this stays below about 15 liters a minute, you'll be fine. So, but the reason about this particular screen here that I look at, this one here, is because when you look at it, you can scroll over to the 30-day mark, okay? So this is your trailing 30 days. So anytime within the first 90 days that this, under 30 days, that this number here gets up to 21 or higher, you'll have met your usage requirement. So that's why I wanted to show you that particular screen. And then here is your settings. There are a couple things you can go in. Generally, I will have these already set to what, probably to the most effective settings. For example, the humidifier. You can set that humidifier to a manual setting, anywhere from 0 to 5. 0 is off, 5 is warmest. Or you can set it to automatic. And that's where I generally start it off at, because what that does is that it actually senses the air temperature and humidity of the air coming into the machine, and then will adjust the output, adjust the setting of that heater plate and that tubing temperature to achieve and maintain a nice comfortable level of humidity coming out of the end here. And so as conditions change, either during the night or night to night or season to season, the amount of humidity you receive will remain consistent. And so again, there's a couple of other things in here, but most of them are off because they're at this point kind of irrelevant. So that's the machine. When we do hook you up to a mask, this machine is set to turn on and off automatically. You put the mask on, you start breathing on it, the machine should sense you wearing it and will turn on automatically. And then you take the mask off, the machine will sense that and will turn off automatically. Or should anyway. There are certain masks with certain design characteristics that cause the machine either to not necessarily turn on automatically, or perhaps they won't turn off automatically. It won't turn off automatically, but if that's the case, it's no big deal. It's generally just a design characteristic of the mask, not an issue with the machine. But if that's the case, you still have your manual start and stop button here. So yeah, so moving on, so when you actually use it, you hook up the mask and you turn the machine on. Like I said, normally it should just turn on automatically, but if it doesn't, you just turn it on, manually. And it'll say starting right up here in the corner. And this is your therapy screen, okay? And it's going to show you. So right now, this machine is set to self-adjust. It's going to start off at that low pressure, and it's going to stay there until you fall asleep, and then adjust as necessary. But what this screen shows you, and it will go dark here after just a minute, you have to keep resetting, but it shows you what your pressure currently is. Okay, it shows you what your leak is. So you're going, even when you breathe in and out, this number here, your liters per minute will go, but this still, ideally, perfectly fit mask, this should stay at or around 0. Sometimes if you're breathing a little bit heavier, the mask becomes dislodged, it'll show a higher number. But again, it's calculated to, every mask has a leak built into it. So yeah, so if that happens on occasion, that's no big deal. As long as it's what what it does routinely. So, however, you use the thing, and then in the morning when you turn it off, okay, this is the screen that comes up. Okay, so this is where I was telling you that your information from last night will be. It's going to show you your usage time. It's going to show you the P95, that's your pressure you were adjusting to. It's going to show you your AHI, again, how much sleep apnea you're still having. We like to see that at 5 or below. And then your leak, your average leak, and your 95th centile leak. The 95th percentile leak or pressure is it's a statistical thing. It's at 95% of the time your leak or your pressure is at a certain level or below. But this is what we look at. And then here you have a score. Okay, this is based on 100 points. So there are 3 factors that determine this score. The first factor, the primary factor, is usage alone. So usage is worth a maximum of 60 points. So anytime you have had over 4 hours, you'll have a minimum of 60 points there. And then the remaining 40 points out of 100 is split between how well your mask is fitting and how well it's treating your sleep apnea. So most people, you shouldn't have any problem, getting a score in the 90s, no problem. But in actuality, as long as that score is over 80, you're fine, okay? The system does not have to be perfect, and that's something that people just need to be aware of. There are issues and hassles associated with this use, and it doesn't matter the mask that you have. There are going to be nights when you're just fighting with it. It's just not sealing, but it is all just to be expected. Again, this is not meant to be a perfect system. So as long as the hassles outweigh or the benefits outweigh the hassles you're having with it, you'll continue using it. So That's your basic introduction to the machine, and then we'll go over more about your individual mask, at the time of your setup. So thank you very much.